I'm Dr. Lloyd Herman, a periodontal specialist in Beverly Hills, California. Today I'm going to talk to you about root canals. Is when a dentist or an endodontist treats a diseased tissue inside of the tooth. An endodontist is a specialized dentist who only treats this. A root canal is done for different reasons. You may have a cavity that goes really deep or may be caused by trauma to the tooth, and then the tooth will get infected. Sometimes the patient doesn't even feel the infection. It lives silently in the body. One of the ways I make a diagnosis is through a CT scan, is a specialized x-ray that shows me a 3D image of the whole jaw and teeth. After 30 years in dentistry, I've seen it all. Many of these infections live silently in people's bodies, just like periodontal disease or heart disease, and they go undiscovered. Amazingly, patients are unaware that it can affect their overall health. And some of them don't even believe that anything needs to be done even after they're told that this is going on. They don't feel it. So since I deal with a lot of holistic patients, root canals, which are considered dead tissue in the body, is not an option for them. They would rather have the tooth extracted and replaced with a dental implant. So it's up to the patient to decide if they want to save the tooth, and if they do, it gets a root canal. The doctor takes the nerve and the blood vessels out of the middle of the tooth and puts a silicone-like filling material called gutta percha. In some cases, even after all this cleaning and filling the canals, there's still bacteria that get stuck in there, and the tooth remains infected, constantly spewing out toxins. So in these situations, the tooth needs to come out. There are some other options that the dentist will propose, but personally, I'm not a big fan since I see a number of them fail. Even after they've been treated, the tooth still needs to be extracted. So in the next video, I'll talk to you about what and how I perform an extraction to effectively remove the tooth without causing a problem. It's not a simple extraction. It requires a protocol to prevent cavitations. Cavitation is a residual infection that remains inside the bone. We'll go over these steps and what you should ask your dentist or surgeon to do a healthy extraction that won't leave you with a residual infection that will constantly tax your system. So thanks for tuning in, and I look forward to seeing you next time.